For the case of Karen Gabry, Dr. Heller takes us through a full body contour, which included a circumferential tummy tuck, lower body lift, and autologous butt augmentation. When Karen walked into the office of Dr. Lior Heller for the first time, she was at ease. Just months earlier, Dr. Heller had reconstructed the breasts of her best friend after she was diagnosed with cancer and underwent a mastectomy. Karen wanted to have the work done after she had lost over 130 pounds after gastric bypass surgery, and she was enthusiastic about the possibilities.
I know I'm going to be a completely different person, because it's going to be a huge change, drastic, because I do have a lot of extra skin in my body after the surgery. I'm doing really good. I promise I'm not nervous. I'm very excited.
On the day of the surgery, her best friend was at her side.
36-year-old patient, lost 140 pounds after a gastric bypass. She has a lot of skin here that is like hanging around. So I'm going to shape the central trunk area much more attractive. So instead of discarding the skin in the back area, we're going to utilize this to give a more round and a nice projection in the upper part of the butt.
Of note in this case, and the favorite of the patient, is the butt lift. The autologous butt augmentation creates a more prominent and perky butt with the patient's own tissue. This special technique involves the removal of skin on the tissue of the lower back and upper butt area. A pocket is created under the skin of the buttocks. The skin is pulled up and then rotated. This gives the buttocks a more rounded contour with better projection. This was the final procedure performed. After nearly 4.5 hours of surgery, Dr. Heller and his team finished. Just the next day after surgery, Karen was up walking using a brilliant new piece of technology, the On-Q pain pump. The device delivers non-narcotic post-operative pain relief for up to 5 days. Important because when pain is not an issue, patients are on their feet faster, getting adequate blood flow to healing areas. And when patients are feeling better and healing faster, everyone's happy. We'll catch up with Dr. Heller and Karen 2 weeks following the procedure at the end of the show. Earlier in the show, we met Dr. Heller's patient, Karen Gabry, who had a full body contour, including circumferential tummy tuck, lower body lift, and autologous butt augmentation. 2 weeks after her surgery, she came in for a follow-up visit.
Do you think that on the butt augmentation you did, is it going to go back to a little bit more normal,
in terms of shape?
Yeah.
Yes, at this point of time...
Dr. Heller makes you feel so comfortable. I wasn't nervous before the surgery. I was actually very calm. I didn't feel scared. I felt I was in good hands.
Understanding the recovery process is just as important as understanding the surgery itself. Dr. Heller's use of the On-Q Pain Buster made Karen's recovery virtually pain-free.
How were the first days after the surgery in terms of pain? Did you have a lot of pain?
I did not have a lot of pain. I think that's the best thing they could have created for this type of surgery, actually. Meeting Dr. Heller and getting this surgery was the best thing that has happened to me. My life changed completely. I have a lot of energy. I work better, I'm a better wife, a better mother, a better person. Yeah.